Today, in what stage of surveillance capitalism is this, the NHS has been sharing your personal data with Facebook without your consent, even though they promised never to do that. Let's look at what data was shared, how this happened, and what we can do about it. Starting with what data they've taken. According to a report by The Observer, 17 of the 20 NHS Trust websites that they looked into contain the Meta Pixel. This has given and continues to give Meta and their whole family of apps access to your medical information, including when you click the button to book an appointment, ordering a repeat prescription, requesting a referral, or completing an online counselling course. The only way this could get more invasive is if they shoved a camera up my arse for some real-time data on my piles. The 17 websites, which serve an estimated 22 million people, contain help and advice information on HIV, self-harm, gender identity services, sexual health, cancer, children's treatments, and more. The report got very specific. For example, Buckinghamshire Healthcare NHS Trust shared when a user viewed a patient handbook for HIV medication. Alder Hayes Facebook Trust sent users details when they visited web pages for problems linked to puberty, mental health services, eating disorders, and ordered any repeat prescriptions. Surrey and Borders Partnership NHS Trust shared data with Facebook when a patient clicked buttons including that they were under 18, lived in Brighton, and wanted access to mental health services, which isn't worrying at all.
Well, I'll just reject all the cookies.
Will you now, me in a hat? Because you know as well as I do that we're not one to turn down a cookie. And besides, in most cases, the data was sent before users selected approve or decline on cookies.
Hasn't this happened before?
Yes, it has. And America seems a lot less bothered by it because over there, medicine and a base level of healthcare for everyone is not seen as a public good because it's all privately owned. And when you think of medicine or medical care as a private business, it makes sense that they might want more data to advertise their for-profit drugs to people more accurately. And I've done a full video on Amazon's plans to own the private healthcare market and why we should all be talking about it more, which is linked somewhere on the screen right now, because I'm fun at parties. But over here, when the government has tried to either give away or sell our data, we've overwhelmingly told them to get fucked. And I sincerely hope we do it again this time.
How does the Meta Pixel work?
Well, me in a hat. Have you ever been browsing the internet for a new hat and then gone back to Facebook and found that exact hat has been advertised to you?
Yes, actually. That happened really recently.
That's the Meta Pixel at work. It's designed to track people on a website that Meta doesn't own in order to get more data from us to sell more increasingly targeted adverts. This data has been sold to, for example, famously ethical insurance companies who can use it to approve or deny your coverage in America.
But how will knowing my medical data help them with adverts?
Well, aside from the wide variety of brands that offer products on sale for certain illnesses or disabilities, they can also use this information to put you in a data profile which tells them what you're likely to need in the future. This is how Target was able to, target a teenager and know she was pregnant before she did. The more they know about us, the easier it is for them to target products to us. Depressed? Here's a sun lamp. Anxious? Here's a plushie. ADHD? Nintendo Switch. Enjoying the video? Like, comment, and subscribe.
But surely all the data is anonymised.
Well, that's where you're wrong, me in another hat, because apparently I'm a marketeer's dream. The Meta Pixel also takes your IP address, which can narrow you down to a household device or location. This means if you've ever logged into a Facebook, Instagram, or any number of other apps that they own, they can match your browsing data to your Facebook data, and boom, they've worked out who you are.
Well, I don't have a Facebook account, so I'm safe.
Red herring, Barry. If you don't have a Facebook account, Facebook will make a shadow profile on you.
What's a
shadow profile? Is basically a profile of data on a person Facebook thinks exists but hasn't formally signed up to the site yet. They're basically gathering data on you, ready for when you sign up. Someone should make a full video explaining how these work. It would do moderately well.
Oh.
Yeah, it's not a great look, depending on which side of the monopoly you fall down on. Once our medical data is on a Facebook server, it's never clear what they do with it or if we can ever have it deleted. This is why I'm confused why the NHS would even be using these tools in the first place. Tracking tools are nothing new, but the Meta tracking tools are known industry-wide to firstly benefit Meta more than the website they're on, and secondly, because Meta is a for-profit company, they only really make for-profit tools, and NHS is famously not for profit. I'm sure the NHS gets some benefits from these tools tools being on their sites, but personally, I can't see the benefits outweighing the negatives. Which brings me neatly onto what can we do about it? Well, we could stop using NHS digital products, but that will hurt us way more than it will hurt anyone else. We could also lobby against a government using these tools, but it's starting to feel like a game of whack-a-mole as they keep trying to either give or sell away our data in different creative ways. Or we could all use VPNs and pretend we live in Ohio and we're accessing NHS services, but that could backfire as we could get locked out for looking suspicious. Basically, we're in a web, a world wide web, created by social media sites that are hungry for more and more personal and invasive data to either sell or use to target us with more and more adverts. And the only thing which could put a full stop to this forever would be a fundamental law. I hate legislation. I hate that it always comes back to this. We have to mandate companies to do the right thing because we can't trust them to do the right thing on their own accord. But here we are. This law would have to restrict their access to our information without our express consent. But that seems about as likely as me turning down a free cookie. Godspeed.